My name is Dr. Rebecca Barnes, and I'm Senior Research Advisor at the RDS in the East Midlands, based in Leicester, and I co-lead our national priority work on equality, diversity and inclusion in the RDS.
I'm Chris. I also co-lead the EDI work in the RDS with Becky, and I'm a Senior Quantitative Advisor for the RDS working in Nottingham.
So we've got 20 minutes in which to introduce to you the Research Design Services EDI Toolkit, and this is a resource that we're just finalising at the moment, and it's been developed primarily for researchers to use and for research advisors in the RDS to use. But first of all, before we kind of get into the detail of that, what it would be good to do is just to kind of set the context around why, as researchers, we need to attend to equality, diversity and inclusion, and why this is something that increasingly the NIHR want researchers to have considered in their applications. So over the last 2 years, we've seen health and care inequalities absolutely coming to the fore, particularly given the uneven impacts of the virus, but also the public health measures to contain it. Obviously, we've seen that particular groups, minority ethnic groups, people with learning disabilities, those who live in the most deprived areas have especially suffered. And alongside this, there have been many other kind of ongoing issues and raising awareness through Black Lives Matters that have really kind of meant that statistics such as the fact that Black women are 4 times more likely to die during pregnancy or childbirth are ones that, you know, as researchers, we really need to attend to. So in terms of our research then, EDI matters because our research needs to identify and target the populations and geography where need is greatest. It's no longer sufficient to simply conduct research where it's convenient. And we need to be aware that those who are most marginalised and underserved in health and social care services are those who are least likely to participate in research. So how can we engage with them and better meet their needs? Another issue is that if we conduct research with very homogeneous samples that aren't then relevant to more diverse populations, then that results in a lot of research waste, which is simply not a good use of time or money. So we need to avoid that. And we also need to know whether some groups are adversely affected by a new intervention, even if it's effective for the vast majority of people. For example, many studies indicate that adverse drug events are much more common amongst women. And that's because they're either unrepresented in the original trial or they're not disaggregated in the analysis. And related to this, we need to avoid harm by developing interventions, services, care pathways, whatever we're doing, that have been tested and developed with a diverse sample. So I'm going to hand over to Chris, who's going to explain about the NIHR's EDI requirements for applicants now.
So the NIHR EDI requirements, these were are dependent on the protected characteristics in the Equality Act, but also they include factors such as socioeconomic status, geographic location, and access to health and social care. The protected characteristics being age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion and belief, sex and sexual orientation. So what applicants need to demonstrate in their applications is how they've considered and addressed EDI characteristics. How will they ensure that their sample is representative of their target population? Which groups that they will recruit from to ensure inclusivity? And we'll come to that in one of the domains in the toolkit. How they're going to collect EDI data on their sample. And that they've considered all potential recruiting locations, not just the ones that may be the most convenient. And we've added a link in there to them from May 2020. Can we have the next slide, please? So we've devised a toolkit. It is for advisors and researchers at the minute to help embed EDI into their applications, the researchers' applications. These are our 8 domains. We have added another one, the 8th one, which is budgeting for inclusion after rounds of feedback from people we've piloted this with and from PPI feedback as well. So we'll go straight into each one, so because we're running a little bit late.
Okay, thank you. So yeah, what we're going to do is to kind of just give some of the key points for researchers to attend to. So what sorts of things you might want to consider when you're putting together your application that are relevant to these 8 different domains. And the first of those is historical context and structural inequality. And just to say that this will soon be available as a web-based version that all researchers will be able to use, and there'll be detailed guidance and case studies and useful references within that package of resources. So historical context and structural inequality is about making sure that in our research, we don't repeat the marginalization of particular groups that have been kind of excluded from research. And that particularly includes women, it includes different ethnic groups, and it includes older people. So your literature review is absolutely key here. And in the background sections to your bid, it's important to be clear about who is affected, where the health and social care inequalities are, and which groups have been overlooked in previous research. And that might inform your awareness of who you need to engage with. It might even help to shape your research questions, but you also need to become aware of what the barriers might be to involving those communities. So what structural historical issues might mean that they have mistrust in researchers? On the slide is an example of the Tuskegee study, which is imprinted in many people's minds still, Black people's minds in particular, as an instance of a research atrocity that meant that Black people's lives were valued less than white people's lives. So that means taking time to learn, it means looking for the gaps, and it means engaging with communities to build trust is key. And community engagement is something that I'll talk a bit more about in a second, but it's certainly something that you need to budget for if it's going to be part of your bid. It is time consuming, can be expensive. So next up is patient and public involvement. And this section of our toolkit has been developed with significant input from our public contributors, Pam Rees, Cecily Henry, and Beauty Schumer, and also facilitated by our PPI lead in the East Midlands, Naina Patel. So increasingly, funding committees aren't simply wanting to see that you have done some public involvement work prior to your application and that it's planned in your bid. They're also interested in how diverse this public involvement has been. And so this might mean that you need to invest in community engagement to break down some of the barriers that I've just mentioned, and also that you need to describe your strategies for recruiting and retaining public contributors. So rather than simply going to those people who are most accessible or those who've got experience of being involved in various studies, it might mean that you need to do some fresh recruitment to get a wider diversity of lived experience. We've got to be careful not to make any individual a spokesperson for their whole commitment or to pigeonhole people, but having that diversity of lived experience will enhance your research and make it more relevant. It's also important to set out how you're going to make your PPI activities accessible. So thinking about choice of venue, perhaps using community venues, timings, having a variety of timings so that people who work or people who have care commitments can be involved. What sorts of cultural sensitivities might there be? In some projects, it might be necessary to have single-sex PPI activities, for instance. There might be a requirement for interpreters, or perhaps you could recruit and train a bilingual community researcher or a community engagement worker. And throughout all of this work, it's important to think about power and how we share power with public contributors so that they have a meaningful voice and can make a meaningful contribution to our research and key decisions that we're making. So research team is the third domain, and this concerns how diverse your team is and how culturally competent your team is. And this can be a difficult issue to kind of scrutinize how diverse your team is. And yet there's plenty of literature, particularly in business and management, that shows that teams where there's a diversity of perspective tend to be more creative, better at problem solving, and less willing to kind of accept the status quo. We've got to be careful, again, not to reduce this down to really simplistic kind of tokenistic behaviours. Just because you have someone who shares a characteristic with research participants, it doesn't necessarily mean that they're going to be cultural competent. It doesn't mean they can be a spokesperson. So for all researchers, critical self-reflection on your own identity, on your credibility with the communities that you're researching, and your cultural competence is key. And you might want to think about seeking out some cultural competence training. If it's difficult to get diversity within your team, then I mentioned recruiting and training community development or engagement workers. That can be a really good strategy to have that bridge between the community and the research team. But what's really key, as the third question indicates, is that diversity needs to make a meaningful difference. So it's not simply about bringing different people to the table just so that we can say they're there, but we need to show how co-working with diverse stakeholders has shaped the research priorities and has meaningfully shaped the research design. And then I'm handing over to Chris to talk about sampling.
So this is about how generalizable that sample is. So has geographical need informed your site? So are you doing it in the place that is in most need of this research? But also in your criteria for inclusion and exclusion, are you excluding anyone? And is this justified? So an example here would be, I work in a bit of respiratory, where sometimes if you want an asthma population, you exclude the under 5s because it's difficult to get objective measures and to say that that under 5-year-old has asthma. But sometimes with, like I say, you have a digital intervention for asthma, then some studies are excluding people over 60 because the assumption there is that they might not be as digitally literate as others, which could be completely false. So if you are making exclusions, these has to be justified. And then also how data is collected for EDI, your EDI sample. How are you going to demonstrate that you do have a diverse sample? And I'll come back to that in the next sections. Back to you, Becky.
Okay, so the next domain is data collection. And here we're asking researchers to consider how they're making their research accessible to all groups within their target population. And there are two sets of issues here. One concerns, how we make existing methods more accessible. So there are practicalities such as language and communication. Do we need to involve interpreters, whether it be for a language other than English or for British Sign Language? Do we need to produce Braille or easy read versions of consent forms or other research materials? What are we doing in terms of the time and place for research or intervention activities? Are we aware of culturally sensitive topics? Are we aware of the need for same-sex interviewers in some situations, for instance? And thinking through how we can decrease the barriers to as diverse a sample as possible participating in our research. But there's also a question of whether some of our conventional methodologies perhaps can only be kind of tweaked so far. And it might be that for your study, it's appropriate to think about some more innovative methodologies, such as creative and participatory approaches. And there are a number of studies that have used arts-based methods or photo voice, for instance, to collect data in a way which is less dependent on verbal communication. So it's not going to be something that's appropriate for all projects, but it's definitely worth exploring rather than always thinking that interviews or focus groups or a survey is the only option to collect data. So back to Chris.
Okay, so this is about data analysis and data presentation. This is about how you describe participants' protected characteristics. Have you picked those kind of categories of people, or have you actually asked the people what they'd like to be called? And then also you've got how are you going to analyse the data? Are you going to do a subgroup analysis for different EDI characteristics? Now, as a statistician, I don't like subgroup analysis that much because they can be very underpowered, and then you can't find a significant result even if it looked promising. But there may be times when this is possible with qualitative data, or if you've got a very large data set, say from primary care data. But again, if you're analysing it, what is the question you're answering? Are you looking for genetic differences, or are you looking for the impact of institutional racism? Or if you're doing around sexuality, are you looking for the impact of homophobia, or are you looking at different sexual practices? Or with the disability, are you looking for the effect of the impairment, or are you looking for the effect of society on the disabled? So the kind of the social model of disability. And then once you have your results, have diverse PPI been incorporated to support the interpretation of results? So there's always a narrative around results, but that narrative can change depending on who gives advice around those results. So if you have diverse PPI, then you can come up with lots of different things. You can maybe come up with lots of different questions as well, which possibly could be more fruitful than the original main analysis. And I'll pass it on to you, back to you. Was it me again? I think it's me, isn't it?
Again, yes.
Okay. So on to dissemination and implementation. So if you get your sample right and you get all the EDI right in your application, then implementation, which is giving this research to everyone, might be quite easy. But if not, then you have to kind of see how this very narrow intervention, if you like, has to be adapted to different groups. And there's not huge amounts of money in that to target that kind of difference in implementation. So if we get it right at the beginning, we can transfer that all the way through. There's also dissemination, where we want to disseminate to inaccessible and inclusive formats, and how is the best way of doing that, and different types of dissemination for different groups of people, lay abstracts, videos, animations. And then also the impact. So what will this have impact for everyone, or just a small group of people? And I think the next talk is about dissemination and impact. No, sorry, not dissemination, but yeah, dissemination and impact. So I'm sure they'll cover that a lot more than I am doing now. But we'll go on to the next slide.
Okay, so our final domain, as Chris mentioned, is a new domain. So we're quite early on in just kind of road testing this and seeing how helpful it is for researchers. But a key question, we've covered a lot of ground in this short talk, and I'm sure that many of you are thinking, what are the cost implications of developing more inclusive research practice? And this is really key to plan out from the beginning, because it's very hard once you've got your budget fixed to then be able to get flexibility for inclusion. And so with each of these domains, we can kind of think through some of the costs that are required. As I mentioned earlier on, community engagement can be very time consuming and carries various costs with it. You might want to put on an event or an activity to attract interest and also to be reciprocal in how you engage with communities. For your data collection, your PPI, you might need to cost in for interpreters. If you have bi or multilingual researchers on your team, then that can reduce some of those costs. It might be that you need a translated version of outcome measures, and so that could increase the cost. And also if you're recruiting from what we call seldom heard communities, if it's particularly important to maybe overrepresent those groups in your research, then that's going to have quite an impact on the timeline for recruitment. You're unlikely to recruit participants into a trial or into an intervention at the same speed that you might if you were just focusing or predominantly focusing on a white British population. So there's also thinking about dissemination costs. If you're going to produce dissemination materials in different versions, maybe you're going to make some videos, perhaps you're going to make those available in multiple languages. Perhaps you're going to involve an animator or an illustrator to, again, get away from so much emphasis on the verbal and present your findings in a really appealing way to members of the public and to your research participants. And all of those costs need to be factored in. And we're still at the point where we're not completely sure how much funding committees will meet all of these costs. And so it's really clear that we justify why these costs are needed and what the implications are of not having inclusive approaches in our research. So I think we're still at the stage where we do really need to spell that out, be very clear about what you need and why you need it and the difference it will make to tackling health inequalities.